It's Rob. I'm back on day 8 following the surgery for the removal of the basal cell carcinoma that was on my scalp. And after 5 days, I went from gauze bandages with dry tape to these bandages. Once the bleeding had stopped and it looked like it was healing reasonably well, I moved to these bandages and they work absolutely fine. These are 2 by 4 inches. So I started taking it off just so I could hurry it along here, because you want to peel this back fairly slowly because this is pretty sensitive stuff, as you will see. So we kind of go side and 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 side, and there we go. And there it is. That's 8 days after surgery. And it's largely full of aquifer, which I use to dress the wound after I've cleaned it. So now I'm going to clean the wound, as you must do every night, and rebandage it. So before I rebandage it, I'll show you what it looks like after I've washed it out. I'm back, showered, and ready to show you the wound now that it's been cleaned out. And here it is. So I'll get that camera up there so you can get a nice look at it. There's maybe a little tiny bit of aquifer from the previous application in there, but I don't think too much. It's looking actually really, really, really good. And these types of wounds, they heal from the inside out. So the name of the game with wound management is don't introduce bacteria into the wound if you can avoid it. So what happens in the shower, first thing, wash the hands thoroughly before doing anything in the shower related to wound management. After your hands are nicely washed and cleaned, then I take some shampoo and I wash all around my head, but sort of stay away from the wound area just to clean off the rest of my head. Then get that all rinsed off, and then take a nice dollop of shampoo on my palm and then put that right over the wound and sort of massage that in a circular motion very slowly for about a minute. And it's going to start aching in about a minute. And then careful when rinsing off, because you don't want the jets of the shower to get into that wound or hurt your wound at all. So I kind of rinse it around, and I use a very low pressure shower head when I'm doing this. Once I get that all off, I do 3 applications of vinegar and water, which I just pour right on the wound. 1 tablespoon of water for 1 tablespoon of vinegar, for 1 cup of water. And then I just pour that in 3 stages, 30 seconds between each one, right on the wound. Now the surgeon had said to use gauze soaked vinegar and water and put that on the wound for about 10 minutes. And I did that for about 3 days, but I didn't like the way that looked. And frankly, gauze is not sterile. So this way, I'm sort of avoiding, I think, introducing more bacteria into that wound than I want to. So then, once that's all done, I then rinse off the head, and also not all of the area around the wound, because you do want a little bit of the vinegar residue to stay there, just a little bit. And then we dry it, and of course don't touch it anytime. And then we're ready to do the next application of bandages. So before I do that, I'm going to clean the area around the wound with some alcohol wipes. Clean it nice right up to the edges, and then around the entire area where the bandage is going to go. And then I'm going to stick in my new dollop of aquifer. And I like aquifer, and I'll tell you why. You can use Vaseline, but if you have a jar of Vaseline and you're using it or other people are using it, that petroleum that's in there is not sanitary, and there's probably bacteria living in there. So with the aquifer, I can squeeze it right out of the tube and get just a nice little dollop right on that wound without touching anything, and I much prefer that. Some people use Q-tips to get that aquifer on there, but to me that's just another surface, and I try to avoid any surface or any touching if possible. And in this case, it is possible. and then I'll bandage that over with the next bandage. I'll go the opposite direction to give my skin a little break. And then I'll be back in about 6 or 7 days and we'll see how we look then. So, on with the journey.